What are some really terrible things that you've seen happen so people can avoid it?
Yep, I have seen, and it is so common, Teresa, people that don't have signed contracts. I don't care if you are going into practice with your childhood dentist, your mom's best friend, whoever it is, you must have a signed contract, right?
Wait, so they start seeing patients and there's no ink on the contract yet?
Correct.
What?
Correct.
Wow.
Or they're going back and forth about edits and they don't have a final copy of the contract.
Oh.
Or, there's nothing in the contract spelled out about, like, if they get a sign-on bonus, what happens if they leave before a year? Do they owe the sign-on bonus back? There's no clauses in the contract about who's responsible for redos.
Oh, wow. Okay, yeah, that can really hurt.
Yeah, that can really hurt. And we see this a lot with those new doctors that are associates, especially. And the other thing I see very frequently is there'll be an issue. The doctor will want to leave the practice, and then it's like, okay, so you signed this contract. Did you have an attorney review it? Oh, no, because that was going to be expensive. Spend the money on the front end for an employment attorney. And specifically someone that deals with contracts.
Yeah.
And obviously your dental associations, no matter where you are, have good contacts for that. But those are the big horror stories. Secondary to that, of course, is the doctor that is working at multiple practices, and one of them is fee-for-service, and then one of them is in network with everything. And there's some sort of clause in there that now they're in network everywhere they go, right? And they don't realize what they've signed until they start getting EOBs with a reduced fee.
Yeah, and that's so hard to walk back. That's Excel spreadsheets like on steroids, like you track everything.
Which directly impacts at the end of the day what the office is getting paid and what you get paid. And I think the last thing, the big horror story that I hear over and over, and not just from doctors now, from team members, from people that are interested in bettering their systems, is gigantic AR. My dad always says the best way to deal with AR is to prevent it.
Yeah. Right? Wise. Yeah, totally wise.
And some of that is like as simple as, I gave you the example of the adult orthodontic benefit. If you're not verifying what adult means on every patient, you're going to do a lot of reduced cost work. If you're not making sure that that preventative is covered at 100%, which sometimes it's not, more and more frequently, you're going to be chasing people with like a $6.20 balance, right? Which just ages and ages and ages and ages.
Yeah. And meanwhile, your $25 an hour employee is chasing this balance. Like, that doesn't make any sense. Yeah.
Not at all. So these are the common messes that I see.
Would you like to hear more? Follow the link for the full episode.